So our next panel of speakers will focus on translating research into practice, translational research. And after the speakers, we will hear from a reactive panel. I will go through the speakers. The first speaker is Steve Sparks, the Health Literacy Director for Wisconsin Health Literacy, which does a lot of good work in this area, so we appreciate that, Steve. In this capacity, he provides consultation and coordination for statewide health literacy strategies and programs for health and social service organizations. Next is Lori Myers. Lori is the Global Health Literacy Director for Merck. Ms. Myers is also a member of the roundtable here on health literacy. And third, we have Brian Jack. Dr. Jack is professor and chair of medicine on the Department of Family Medicine at the Boston University School of Medicine. Finally, we hear from Charles Lee. Dr. Lee is the president and founder of Polyglot Systems, Incorporated, a company which seeks to develop practical and affordable multi-language technology solutions to improve access and reduce disparities for limited English proficient patient populations. You'll remember I mentioned that this conversation will be had this afternoon. Following the presentation, we'll hear from our reactive panel. That panel consists of Donna Horn, a pharmacist who is the Director of Patient Safety and Community Pharmacy with the Institute for Safe Medication Practices, and Shauna Yeen, who is an Associate Professor of Pediatrics and Population Health at the NYU School of Medicine, my alma mater, NYU School of Medicine, Bellevue Hospital Center. As with our morning panels, this one will be followed by a discussion period. So I'll ask you once again to please hold your questions and comments until then. And Mr. Sparks, you can begin. You're welcome.
Good afternoon, and thank you for this opportunity to share some of the work that we're doing in Wisconsin. I'm going to start with everyone has a story. And in our work, this should be the theme for the project that you're going to hear about today, because everywhere we go, people want to talk about medications, and everybody has a story about how a friend or family member or themselves had a problem with medication and had a near disaster because of misunderstanding the instructions or how to take the medication. As we tell others about our journey to improve medication labels in Wisconsin, the stories we hear serve as a constant reminder of just how important our work really is. My story today is about how Wisconsin health literacy is implementing easier to understand prescription medication labels in our state. Now, as many of you know, new patient-centered labeling guidelines were released in 2013 by the USP. Shortly after that, we applied for a grant and received it from the Wisconsin Partnership Program of the University of Wisconsin School of Medicine and Public Health, with the goal to implement these standards in Wisconsin. After completing, so we followed through with doing some research, and then after completing that research, we knew our work was not done. So we started calling the first work Phase 1, and we are now in Phase 2. And Phase 3, which Phase 2 is really adopting these standards in pilot pharmacies, and then Phase 3 will be expanding these standards throughout the state of Wisconsin, as well as exploring some of the issues that we're not able to address in our current phase. In Phase 1, which we call up on the screen barriers and facilitators, we were exploring we actually interviewed pharmacists and pharmacy managers in independent pharmacies and in chain pharmacies. We also talked to physicians, and we talked to representatives from companies that provide software that's used for running labels in pharmacies. And lastly, we interviewed stakeholders from other states where patient-centered guidelines have been implemented. So here's what we learned from Phase 1. Pharmacists supported the USP guidelines. However, we found that most of them were not aware of them, or else they may have heard of them and forgotten them since they were first heard the communications about them. But after learning more, The pharmacists felt that the new guidelines would improve readability and reduce confusion. Secondly, we asked about workflow in a busy pharmacy, and most pharmacists felt the guidelines were compatible with the current pharmacy workflow. Third, the people that we interviewed did identify some potential barriers. Most commonly mentioned was the limited space on labels, what they called the real estate, and the flexibility of pharmacy software programs to make the changes. Other potential barriers were organizational buy-in and cost. Additionally, pharmacists noted that many customers request the medication purpose on their labels, such as for high blood pressure or for high cholesterol. However, most pharmacies did not have access to that information. Fourth, most people interviewed did not feel that they needed additional evidence in order to convince them to adopt a new label. They felt the benefit was clear. And lastly, while some states have patient-centered label standards in place, only one state had actually tried to mandate the USP standards, and this was not as successful as they had anticipated. On the screen, it shows the cover of this, which is our report from phase 1, and this is available just incidentally from our WisconsinHealthLiteracy.org website for download for anybody interested in reading more of the detail about that research project. So moving on to phase 2, energized by the pharmacist support from phase 1, Wisconsin Health Literacy then applied for and received a grant through the Advancing a Healthier Wisconsin Endowment of the Medical College of Wisconsin. And this was to launch efforts to redesign labels in 3 pilot pharmacy systems with 52 individual sites. So you can see here, this is a map of where these pharmacy locations were in Wisconsin, and all the colors are a little bit difficult to interpret there. UW Health, which is the University of Wisconsin main hospital and clinic system, had 14 locations in and around Madison. Those are purple, if you can see it. Hyatt Pharmacy, which had 9 locations, mostly located in low-income neighborhoods in Milwaukee. And then Hometown Pharmacy, which had 29 locations in southern and eastern Wisconsin, mostly in more rural areas. Together, these systems issue 1.8 million prescriptions a year. And for purposes of this project, it was helpful that each one of the systems uses a different pharmacy software vendor. So the systems being used are RX30, Enterprise RX by McKesson, and Pioneer RX. And this was valuable to us because it will give us experience in expanding implementation to more pharmacies in the future and looking about how the process may be implemented or may be impacted by the individual software that they're using. Our goal is to implement and evaluate the USP guidelines by redesigning labels in these pilot pharmacies by the end of 2017 to help us more efficiently and smoothly implement the standards across the state in phase 3. Based on our earlier research, as well as the experience in other states, we're pursuing a voluntary adoption strategy rather than a mandatory one or a regulatory one. So the phase 2 project began in January 1st, and I'd like to highlight some of the main activities going on to this point. So first of all, we have exceptional expertise in what we call a project advisory council. And so in addition to the pharmacy partners, this council includes other key stakeholders, such as Michael Wolf, who's in the room today. And it also includes, we're very appreciative to have the involvement of USP itself through Donna Bohannon, who I think is in the room, but she's here today. There she is back there. And we're benefiting from the fact that Epic is actually located in Madison, our hometown. So we have a representative, one of the leaders of Epic on our team as well, who's looking at the implications of what we do for potentially changing label standards in Epic, which could virtually have an international benefit, ultimately. A representative of our key pharmacy group, the Pharmacy Society of Wisconsin, is also a member of our advisory council. Secondly, perhaps the most interesting and informative has been the patient focus groups that we did to design the new labels. These groups consisted of individuals who typically may not have had a voice in the projects such as this, but whose input is essential for the work that we're doing. They were enormously helpful in determining what information should be included where on the label. And one of the most interesting activities involved them actually designing their own labels. And here it shows a picture of two of them who are very, very, very proud of the label that they put together based on enlarged elements of the USP standards. These enthusiastic members were also very willing to share their stories. And one woman told us she had a terrible experience because she was taking care of her mother who had diabetes, and she had all kinds of medications that she was giving to her mother. And she was so confused about the instructions, and she was just really, really afraid that she would do something that actually would be disastrous to her mother and her mother's health. Other comments from the focus groups were perhaps not directly applicable to the project, but some of which really made us think. For example, some of the members felt that pharmacies are there to help, and some strongly vocalized that they're just there to make money. And another observation, perhaps the most interesting, was the perception that pharmacies give lower quality medication to the poor. And there was a number of people who felt that generic drugs were given to the poor. Thirdly, we benefited from a patient advisory council, and this is a photo of them actually looking at a current label. This patient advisory council is made up of community members, one of whom also serves on the project advisory council. The patient group meets quarterly and is looking at surveys and other communications. We're now entering the really exciting part, which is actually implementing the redesigned labels in the pharmacies themselves. We're working on the final versions of the labels now, and in December they're actually going to start to appear in the pharmacies. And I've got a couple examples up here just to show you. This is the one from Hyatt Pharmacy, and again, this is not the final version. We're still tweaking this. But one of the things I wanted to point out that talks about the variability of these labels in different pharmacies is in the lower right-hand corner, you see that the RX number is quite small. At Hyatt Pharmacy, they don't use the RX number, the prescription number, as an identifier. So it's not very important to them. It's the name and some of the other things that really make a difference to them. This is the hometown pharmacy version, and take a look at the complexity of their current label up in the upper left-hand corner, and what that looks like when you take it and change it to some new standards and type and spacing and all those kinds of things. In April of next year, we're going to be holding a day-long medication label summit. And this is going to be on April 3rd of 2017. And it's going to feature testimonials from our pharmacy partners as well as presentations. Mike Wolf is going to be there to make a presentation. Dr. Ruth Parker, among us today, is going to be there to make a presentation as well. This event is a key tactic in sharing learnings that have happened so far, and then also in encouraging other people to get interested in potentially adopting the new labels in phase 3. As we implement the redesigned labels, here's what we've learned so far. First of all, each pharmacy has its own process and a unique relationship with the software vendor. So you can't work with the pharmacy without working directly with the software vendor. Second of all, pharmacies differ in how they want to adopt new labels. Some of them are willing to start from scratch and throw out all the old label stock. Others have literally tens of thousands of labels sitting in a storeroom someplace that they want to use up, which causes workarounds because you've got to apply new standards to old color blocks and logo placement. Some pharmacies insist on including information not in the USB guidelines and not required by law, but which are important to their workflow. So for example, one of the 3 pharmacy systems wants to include the NDC number on the label, and several want to include the medication description. While still adhering to the USP standards, we were able to be flexible and accommodate these. Fourth, pharmacy team involvement in the process is really important. It was really important that the pharmacies felt like we were working with them to come up with the new labels and the processes, not just giving them a set of standards that they had to adopt. I don't think that that would have worked. And as a result, the process is going much smoother and faster. Some of the standards in the USP guidelines will be looked at in the future, and this is due to the complexity of resolving them and the outside systems that would have to change. For example, the medication purpose on the label, which would require a massive change by providers, as well as some changes with the electronic medical record software. In addition, we're looking at how we could eventually do the standardization of the medication dosage instructions, which is another challenge because of the not a universally accepted, at least, set of standards and the different problems that occur in different software packages on using those standards. Lastly, you need to involve all major stakeholders, including the pharmacy board and major chains. We've received good comments from Walgreens and other major chains about the project that we're doing while acknowledging the challenges of a multi-site area. And the pharmacy board we'll be working with them in December to share some of our project and what we're doing. The next steps, we're going to be working closely with our partners to monitor implementation. We're going to be surveying patients at these 3 sites to see if they've noticed a change and if they like it. And we're thrilled to be able to work with a health plan, a Medicaid health plan that serves a lot of the patients at Hyatt Pharmacy, because we're going to be able to do some data analysis looking at records to see what it looks like as far as people refilling and their prescriptions and getting new prescriptions and using their medications. We look forward to learning more and more about this project and to applying the information to broader interpretation and implementation of patient-centered labels across the state in the 3rd and final phase of the project, which we hope will start in 2018. We believe that the journey to better medication labels has begun and that the project could have implications well beyond the borders of Wisconsin.